Hi everyone, I'm Dr. Scott Theirl, board-certified chiropractic neurologist and owner and founder of Functional Restoration, my private brain-based practice that focuses on getting you to feel your best, not only in terms of your nervous system, but also your body. I'm choosing to take the next few minutes just to quickly educate you on what this practice is. Because as a potential patient, you're wondering, how does this all tie together? How does this actually all work? And I think we can summarize it in 3 different areas. The first of those areas that you would expect most any chiropractor to work with is really orthopedics and biomechanics. And certainly I'm well trained in all of those things. You know, how is it that different aspects of your spine, your shoulder, your neck, your elbows, your hips, your back, your knees, tie all that together. And let's make sure that from the bottom up, all the way up, from your feet all the way to the top, we're looking like we have symmetry and strength and good tone and balance. And that's what orthopedics and biomechanics are all about. The therapies there tend to be things that you're familiar with, right? Different aspects of adjustments and manipulation. Let's do soft tissue work with your muscles, whether it be with ultrasound or electric stimulation, stretching or rehabilitation and strengthening. If your feet and your knees and your hip and your back are all a problem, and that's called your lower kinetic chain, then let's make some orthotics for your feet and figure out what's going to work best in your shoes. Support your feet and watch the rest of your body start to find balance. So that's the orthopedic biomechanics side. Step 2. The brain-based neurological re-education side of things. This is really where the postdoctorate training in neurology comes in. I have hundreds and hundreds of hours over the course of the last 15 years of how do we rehabilitate a brain so that it works well with a body and vice versa. And that's what brain-based rehabilitation really is. This comes into play with people that have had chronic neurologic conditions. Now, it could be somebody that just has chronic pain, certainly people that have had post-concussive syndrome, multiple different vehicle accidents and car accidents where they have chronic whiplash issues, children with learning disorders and attention issues, individuals with vertigo and dizziness problems, movement disorders and challenges with coordinating their body and moving their body through space and gravity. All of these fall under neurologic conditions that a functional neurologist like myself would typically entertain treating and entertain helping that patient get to a higher state of function. Once we have the orthopedic biomechanics and we have the brain-based rehabilitation, we want to add to it the third mix. And the third mix is very exciting. Now, I just call it good old comprehensive care. It goes by a lot of other terms out there. It goes by integrative medicine, it goes by functional medicine. What does it mean? It means we're using the technology that we have in terms of laboratory assessments to look at the biochemistry of your individual body, to give us kind of a fingerprint of your own biochemistry at that moment in time that we're going to do the tests. What would we be looking at? Everything from specific blood chemistry analysis on through different hormones, sex hormones, stress hormones, neurotransmitter testing, food allergy testing, inflammatory markers, all of these different aspects of tests that you can do through urine, through blood, through saliva. Not doing every panel on every patient, figuring out which ones specific to that patient's needs are most important right now. For example, if you're somebody that has low energy and it started with perimenopause, by all means, looking at sex hormones may be appropriate. But it's also important to look at thyroid function, look at adrenal function. Your adrenal glands live on top of your kidneys. They respond to stress, and your thyroid and adrenals work with each other all the time. Let's look at the other neurotransmitters that may fatigue with chronic stress response and see how your body's holding up with your own individual lifestyle. And then let's come up with holistic, integrative ways, natural ways, through lifestyle, through diet, through supplementation, to get you to a more balanced state. If some of these markers are too high, we naturally want to bring them down into a balanced state. If some things are looking depleted, we want to build them back up so that you have full fuel tanks with these individual markers and your body has them available to use. So that combination of comprehensive care metabolically, along with brain-based rehabilitation, along with orthopedics and biomechanics, makes functional restoration a pretty special place. I pride myself on my knowledge and my training that I've had. I've been in practice since 2000 and I love working with difficult and challenging cases. If this is something you think might be of benefit to you and you want to talk about it, either shoot us an email or give us a call. Be happy to talk about it on the phone before you become a patient. Thanks for spending a couple minutes with us. It was a pleasure. I hope it was helpful in integrating your idea and synthesizing the information that you see here on the website hearing it in video form so that you're a little more comfortable with what is a functional neurology or a chiropractic neurology type of practice all about. Take care, be well, thank you for listening.